Welcome to the Girlfriend Doctor Show. I'm Dr. Anna Cabeca, your host and guide on this journey to reclaiming hormone balance and vitality so that our health span equals our lifespan and also our joy span. Today, we're diving into a topic close to my heart, and it's about hormone balance and the power of two major hormones, our mother hormones, progesterone and pregnenolone. So, in the first section, I want to talk about understanding hormone imbalances. And it's important to understand this because as we age, our hormones change over time. We know this from the time of puberty when we have great swings and a resurgence, a surge of our reproductive hormones through our reproductive years, and then the decline of these hormones into menopause, with the first hormone declining being DHEA in our mid to late 20s, and then progesterone in our mid to late 30s, we start to see a decline in this very important mother hormone. And if we look at the hierarchy of hormones, we know that all of reproductive hormones have an important role. But when we think of how the metabolism of our hormones evolved, we metabolize our hormones from cholesterol. So cholesterol is important within the cell membrane at the mitochondrial level to produce our hormones, and this is key. If we have an imbalance in our hormone production and we're not producing enough of our hormones, or we have our cholesterol's too low or it's suppressed, as with statin medications or for other reasons, it's not functional and we're not making these mother hormones as much. Our progesterone and pregnenolone are really derived from ovaries and the adrenal glands in women and the adrenal glands and testes in men, and both make these hormones. So from cholesterol, we make pregnenolone, which is an important hormone. It's a neuroprotective hormone. It is a mother hormone precursor to all our other reproductive steroid hormones. And also it has been shown in scientific studies to promote brain health, bone health, and increase memory and improve mood. So it's an important one here. Now, from pregnenolone, we make progesterone. And progesterone you hear a lot about, and I want to make a distinction between bioidentical progesterone versus progestins. They are not the same. So for example, the progestin in birth control pill is a synthetic progestin. It is not identical, does not look identical to what our body's making naturally. And it doesn't act in our bodies the same way. In a recent publication this April 2024, in the Journal of Menopause, they published a 10 million women analysis of Medicare patients on Medicare, and looked at them and what form, based on their prescription usage and their clinical diagnoses, what form of birth control, what form of hormone replacement they were on, if they were on any, and what were their risks. And hands down found that the risks associated with progestins were significant, including breast cancer, as we saw in the Women's Health Initiative trial, as well as cardiovascular disease. With progesterone, we did not see any such increased risk. Now, from progesterone, we'll go on to make our reproductive hormones, but most importantly, cortisol, our fight, flight, and freeze hormone, or our tend and befriend hormone. So when we're in this state of making a lot of cortisol, we can feel any one of those tendencies. And it can, for women, we tend to retreat inward. We may feel paralyzed or isolated. We may fight, but that's usually not typical for women, more so with men, but yet women can experience that too. And the flight is that feeling that we need to escape. And if any of you have felt that, probably making too much cortisol or not enough cortisol, and that can be a function of an imbalance in hormones. So from progesterone, we will, deplete our natural progesterone reserve in order to make this life-saving cortisol hormone, so we can become depleted. So from progesterone and pregnenolone, we're going to make DHEA and testosterone and then estrogens, and in that order. via different enzymatic pathways, and it's all important. So when we're out of balance, when we're more stressed, when we're depleting our progesterone and pregnenolone levels at a more rapid rate than we're able to produce them, especially in the perimenopause and menopause, we can experience these symptoms of hormone imbalances such as mood swings, fatigue, and weight gain, to say the least. Symptoms of progesterone insufficiency often predate symptoms of estrogen deficiency, but yet they can both occur simultaneously. Now, oftentimes you may have heard the term estrogen dominance. When you have a imbalance in estrogen and progesterone, it's really more often related to progesterone insufficiency, unless there are other factors like hormone disruptors, body's impairment or inability to detox estrogen well. But the symptoms are very similar. These include mood swings, irritability, depression, and oftentimes our current medical treatment is to say, okay, well, let's go ahead and give you a SSRI, a selective serotonin reuptake inhibitor, such as Prozac or Cymbalta, or one of the many that we have at our hand, in our doctor's bag, so to speak, that we're able to prescribe you. Other symptoms, but that's not addressing the root cause. It's important to understand that where sometimes they're necessary, but we also at the same time want to address the root cause of what's going on, this progesterone insufficiency or estrogen dominance or impaired estrogen detoxification. Gynecologic symptoms that can occur at the same time related to this imbalance in progesterone and estrogen are regular menstrual cycles, breakthrough bleeding, heavier than normal periods, increased pain with your period, ovarian cyst production. Those are very common. So you go to your gynecologist and they just may say, okay, well, let's just put you on a birth control pill. Even if you've had your tubes tied or your partner's had a vasectomy and you don't need it for birth control, this is often what's in the doctor's bag. And if that doesn't work, they may say, okay, well, still, patient may come in and say, I'm still having some breakthrough bleeding. I don't like how I feel on this, and my periods are still painful. And the doctor may say, okay, well, now we need to do a hysterectomy. Well, we haven't addressed the underlying issues. And then oftentimes a patient will continue to have symptoms or worsening symptoms, such as, because again, the root cause was never identified, this imbalance issue, or we haven't supported the body's natural production and detoxification. So clients will come in experiencing a decreased libido, headaches, fatigue, short-term memory loss, not remember the last time they had sex, and it may be because of short-term memory loss or it's just been a long time, a lack of ability to concentrate, thinning or loss of hair, as well as lackluster to our hair. And we may experience dry skin, rapid aging, an increase in facial hair, dry aches and pains, maybe that frozen shoulder, arthritic symptoms, vaginal dryness and water retention, and weight gain, specifically around the hips and thighs and the abdomen. So all of these symptoms can, persist if we've just band-aided the symptoms, essentially, just treated the symptoms and not addressed the underlying reason. So, what else does a gynecologist have to offer you from that point? Well, hey, my dear friend, patient, here's a great psychiatrist I recommend, and also here's a great divorce attorney. Now, we don't want to go there. We want to address the underlying reasons that this is happening. And often it's because of this, you know, natural decline in our body's ability to make progesterone. The adrenal glands quite aren't picking it up because here we are in midlife and we're under stress. We have many hats. We may be raising teenagers. We may be really at a very stressful point in our work or our relationship. And all of these changes take a toll on our physiology unless we're really working with mindset and being grateful in the present moment and increasing oxytocin, the most powerful hormone in our body. Because I always like to say, with our hormonal hierarchy, oxytocin is the most powerful hormone in our body. And we want to address the underlying major hormones such as adrenaline, cortisol, and insulin. And then we can work on the reproductive hormone. So this is kind of like when we address our major hormones, we're kind of filling the holes in our bucket, and then addressing the minor hormones or the remainder of our reproductive hormones, and we are refilling our bucket. So important to look at it from both aspects. Now, we know as as physicians, progesterone is important in that second half of our menstrual cycle to stabilize the endometrium and to promote a healthy space for pregnancy to occur. It's essential for maintaining pregnancy. It's called the hormone of pregnancy. Progesterone means like essentially pro-life hormone. And when we're no longer in reproductive ages that or we don't get pregnant, then that progesterone functions to have an organized withdrawal, clean out the inside of the uterus, and you have this withdrawal bleed, your menses. Now, if you're not regularly menstruating in the premenopause, we really want to balance that. Perimenopause, it can be irregular, so supporting your body, your adrenals, and your ovarian function, and decreasing a toxic hormone burden from hormone disruptors becomes even that much more important to balancing your hormone. Again, addressing the underlying reason that you're experiencing all these symptoms. Progesterone also supports your immune system via the Th2 immunity. So it is neuroprotective. It's been studied for brain health, for memory, for cognition. It's a natural anti-inflammatory. It is essential for sleep. So if you've taken progesterone and experienced the benefits of getting a better night's sleep, well, that's why. It really does help support GABA production, which is it's like an anti-anxiety neurotransmitter, and supports your body's natural production. And it just makes all the difference in the world. So focusing on the underlying reasons and addressing them makes a really big difference. Bioidentical progesterone can improve cholesterol, can inhibit coronary vasospasm. So in other words, sometimes a perimenopausal or a menopausal symptom of irregular heart rate or arrhythmia or palpitations can be a symptom of this lower progesterone. It's a natural diuretic, whereas progestins increase fluid retention. Progesterone naturally helps you release fluid. It supports your thyroid hormone activity. It's a natural antidepressant. So I use this a lot, especially with clients with PMS or perimenopausal depression and anxiety, that bioidentical progesterone can support this. Progesterone's also been shown scientifically to help bone growth and support in studies by Dr. Fournier, who looked at 88,000 women in a French study. The E3N study found that bioidentical progesterone did not increase breast cancer, whereas synthetic progestins did. And so it's important differentiation. And there's a lot of confusion. Do we need progesterone if we've had a hysterectomy? So the myth is that we don't. No, but we do, because progesterone promotes all those things I just told you, promotes brain growth, helps with a good night's sleep, promotes memory and cognition. It makes a true difference. And again, in the 10 million women study just published in this April, showed that progesterone can help with cognition and brain health and reduce dementia. So these are important things to understand. So with or without a uterus, don't you want those benefits? Well, that's key. And it's so important to really understand this aspect of of balancing our hormones and supporting our body's natural production. So what we do in our Magic Menopause program and with my keto-green nutrition and lifestyle foundations is decrease the drain on progesterone and DHEA that from our adrenal glands. So by doing that, we have more of our natural hormones, that production. We're using them better because we're detoxing the hormone receptor sites, and our body's able to use these hormones better. We're decreasing our toxic burden, eliminating those hormone disruptors, and using medicinal menus to help support your body's anti-inflammatory processes as well as detoxification of toxic estrogens. That's all kind of blended in. When we look at foods that help support that, we think of our cruciferous vegetables such as the broccoli sprouts or broccoli, cauliflower, cabbage. Those are so beneficial to our hormone metabolism. Flax seeds and soy isoflavones are also very beneficial for healthy estrogen detoxification and hormone metabolism. So kind of combine it in these ways. Now, as our hormones are naturally declining and we start to get lower levels of pregnenolone and progesterone, one of the first things to fall off, like, or to worsen at this time period, is our ability to get a good night restorative sleep. And this is really important because if we're not sleeping well, we're not repairing, rejuvenating, regenerating. When we sleep, our body's doing a lot of work to help us support and replenish our hormones and decrease inflammation and detoxification. So we want a good night's sleep, but progesterone, as progesterone levels decline, we have less available tryptophan. From tryptophan, we make 5-hydroxytryptophan, and from 5-hydroxytryptophan, we make serotonin. So right alongside of decreased good night's sleep, more anxiety, depression, irritability, mood swings, those can come into place. And from there, we're not making enough melatonin to get that good night's sleep. And then this is a forever, like, dog chasing its tail type of scenario, unless you make an intervention, unless you support your body's natural restorative and regenerative processes. So we go deep into that through my Magic Menopause program and through my keto-green lifestyle. That's a piece. And then using supplements such as adaptogens, like in my Mighty Maca Plus. And there's a reason these products are recommended by physicians and practitioners around the world, is because they work. Another key way to supplement in menopause, perimenopause, and menopause and beyond is using hormonal creams or getting them prescribed orally, such as progesterone. Oral progesterone is a prescription. Oral progesterone is metabolized, 90% of it's metabolized by the liver, and so 10% of it's available. But now those metabolites of oral progesterone can help you get a good night's sleep. Typically, as a physician, I'll prescribe progesterone 200 milligrams or maybe 100 milligrams, or sometimes even 300 or 400 milligrams, depending on the patient. And pretty much as a foundation, in most all of my clients, I recommend topical progesterone and pregnenolone because it's safe to absorb the progesterone and pregnenolone through the skin or through the vulvar area or vaginal tissue. You can absorb topical progesterone and pregnenolone. Where does this come from? Well, one of the sources of bioidentical progesterone and pregnenolone is wild yam. From wild yam, we make diosgenin, which is a precursor to progesterone and pregnenolone. And so from this, we can make bioidentical progesterone and pregnenolone. And that's how I created my balance cream, which is natural progesterone and pregnenolone derived from wild yam. And I added into it a great anti-aging skin ingredient called tripeptide, as well as essential oils to help with rejuvenating, giving you good glow and decreasing age spots, fine lines, and wrinkles. So the combination of these ingredients work really well. Plus, they help support your body's progesterone level. Look, when we are using a transdermal, we're not going to see it in the blood like we would an oral formulation. We will need to look in the urine or saliva, but typically I'll look in urinary metabolites. I use the Dutch test a lot once a client is on on any hormonal transdermal cream or transvaginal cream. If you are on oral estrogen and you have a uterus intact, topical progesterone and pregnenolone may not be enough. We often add in, if I have a client on estrogen, I may add in additional oral progesterone, or again, depending, I look and monitor my clients with ultrasound, pelvic ultrasound, and I look at their uterus, look at their ovaries. It's very valuable and minimally invasive study, no radiation involved, to do a pelvic ultrasound. And then this way we get to look at the ovaries and to look for any fluid within the peritoneal cavity. So part of my, in my practice, I often order ultrasounds to make sure everything's going okay. If there's a thickening of the endometrial lining, the lining of the uterus, then we want to increase the dosages of progesterone to thin that out, as well as maybe warrants a endometrial biopsy or additional investigation. So it's important when you're on hormones to look at this. If you're on oral estrogens or even transdermal estrogens, certainly if you're on pellets, we need to make sure you're on adequate levels of progesterone. And that makes a big difference also in how you feel, but and for safety of protecting you from endometrial cancer. So a lot of great benefits to progesterone and pregnenolone. And in my practice and in creating topical options for clients to give them that benefit, whether they have a uterus or don't have a uterus, it's important to see that see those improvements. Now, I'll give you some testimonials that I'll tell you how to use topical progesterone and pregnenolone cream or my balance cream, but I want to give you some testimonials, some of the symptoms that people experience that are improved with using this cream. Cynthia wrote in and she said, within about 2 weeks, I noticed less anxiety and deeper sleep. I turned 70 this year and have zero hormones, but this truly helps. Kathleen said, my body felt a sense of well-being and my brain became sharper and clearer. Something I recognize, especially in using progesterone in clients and pregnenolone in clients who have had a hysterectomy and weren't on any hormone replacement, they will always come in and say, Dr. Anna, I feel like the cloud has lifted. I see the world in bright colors. It's no longer in shades of gray. So it's important. Naomi wrote in and she's over 65 and she said, balance helps me with night sweats. And when I have to leave it off for the suggested time frame, I'm always ready when it's time to start again. It helps calm me and it helps me stay calm and sleep better. I'm very appreciative of Dr. Anna Cabeca and everything she does for making life easier for postmenopausal women and others. So I love these testimonies, and there are hundreds more on my website that you can look into yourself as well. Now, how do we use topical hormone creams, or how do we take progesterone? Now, there's ways to take it continuously post-menopause. I typically recommend 1 or 2 days off per week or 3 to 5 days off per month. And that is to keep the receptor sites open and to work with your natural, like that natural fluctuation, a natural fluctuation in your hormones. And it helps with the HPA axis regulation. So we want to keep that consistent. I do not believe in women postmenopausally having to have menstrual cycles. That means you're on a higher doses of estrogen and only on progesterone for a couple weeks of the month. And that's by nature not how we're designed. And from doing this now, working with bioidentical hormones for over 25 years, this is typically what works best for me and my patients, for sure. And so let's talk about some of the other ways to use. So with balance cream, you can apply it on thin skin. I like to use it on my décolletage area, my neck and chest, because this is one of the areas, honestly, we age the most. And anywhere we have thin skin and is a good place to put progesterone. So you could use it on your inner wrist, in your antecubital area, that's the opposite side of your elbow, on your behind your knees or on the vulvar area, and lower abdomen. Those are typically good places to use the topical progesterone. And if you're taking it orally, typically you can use it at night. Now, for some clients, because progesterone is making cortisol. And if they're in that foot on the gas pedal state, they're making a lot of cortisol. When you take progesterone, specifically orally, you may feel more anxious. That's a sign that, okay, let's start with transdermal. Let's really work on resetting that cortisol pattern and your circadian rhythm. Let's focus on getting that stress level down. And then typically you can, you'll respond better. And feel 100% better when you don't have cortisol ruling your life, for sure. Okay. Now, I want to share with you some of the beneficial ingredients in my balance cream and why I put them together. So, as I mentioned, I use progesterone and pregnenolone derived from wild yam via diosgenin. So, these are bioidentical, looks like what our body's producing. So, and what we know about progesterone, it's a powerful hormone and it promotes memory, eases PMS and anxiety, and improves sleep and libido while reducing inflammation and joint pain, as well as hot flashes and weight gain. Pregnenolone, an incredible hormone for mood and memory and cognition. It also helps fight fatigue as well as stress and depression. It can also help with your joints, and low science has shown that it can help support healthy cholesterol levels. Tripeptide 29 is a skincare ingredient I put in that helps to strengthen the skin and improve an uneven texture, decrease those age spots, as well as reducing the look of fine lines, and improves hydration and elasticity. It's a small size, so it's absorbed quickly and easily through the skin. I added grapeseed extract because it's high in antioxidant. It's good for skin rejuvenation, a healthy, beautiful glow. And science has shown grapeseed extract improves brain function and aids in wound healing. So it is an excellent addition. Coconut fruit extract is in here too because many benefits of coconut. It's a great emollient, soothes the skin, is natural anti-inflammatory, antifungal type of effects according to the research, and smells good too. I added rosemary oil because rosemary oil has great science behind it. Improvements for brain function, so it's great as an essential oil to use separately. It's been shown to stimulate hair growth and reduce anxiety and can help with energy levels as well as digestive health. Transdermally, it does improve the texture and again, the elasticity of the skin as well. With lavender oil, I put that in here because in general, if we're using progesterone in the evening, lavender oil can help improve sleep, relaxation, also has been shown to reduce fine lines and wrinkles and improve overall the skin's appearance. So you get that healthy, beautiful glow. There's so many benefits. When I looked at this as a chemist originally and then having my own skincare line way back, recognizing that when we're using something, we want to get the benefits for our overall health, physically, very important. But in order for us to have compliance in using something on a regular basis, it's kind of nice if it has those rejuvenating aspects to it. So that makes us use it more regularly. And my patients tell me that all the time. So it's important to kind of look at, do you need it? Do you not need it? What symptoms are you experiencing? Have you tested your hormone levels? Are they in optimal ranges? Those are important things to look at to see, okay, well, how am I? How am I doing? In perimenopause, when your periods are irregular, it kind of gets hard to time the use of, if we're adding in progesterone and pregnenolone, if we're or balance cream or supplementing with a prescription, it gets tricky because periods can be irregular. Premenopause, we want to support the luteal phase. And so that will be from after ovulation till the day of first menses. So typically day 14 to 28 of your cycle. Again, it depends if you have longer cycles. The average cycle is around day 28 to 30, but they can be normally 22 to 42 days, just depending on your body's own natural clock, but typically around 28 to 30 days. And that's where the birth control pills came up with this 28-day regimen also. So the pills are 4-week packs, and it kind of puts you on that 4-week cycle, but you want to listen to what your body's doing and get into following and supporting its natural rhythms. Perimenopause. So, what do we do when the periods are all irregular? I typically say from the time you start bleeding, that which is cycle day one, wait about 8 to 10 days and then start using your progesterone cream or progesterone prescription and use it until your first day of period or for 20 days. And if no cycle, go ahead and stop for 8 to 10 days and then start it again. And try to follow that regimen. Some of my clients like to follow the lunar cycle and based on their prior history of their menstrual cycles, as well as some clients just like to base it on the calendar months. It really depends on you. So, and how you're going to use it and how you'll be regular in your use of it. Um, how old do when do you need to stop using progesterone? Like a couple of the testimonials I share with you, I have clients in their 70s and 80s on bioidentical hormones. And I don't discriminate on age. I want to optimize your body's health overall, create bodies that are inhospitable to cancer, that have a strong resilience, you can bounce back, that you feel good and show up as your best self every day. And so that shouldn't have a time limit. And recent research with the 10 million women study showed that women well past age 65 did well and benefited from continued use of hormone therapy, estrogens and progesterone as the preferred treatment. And I add in pregnenolone because of the additional benefits of pregnenolone for mood memory. And I just found in working with thousands and thousands of clients that it works better. It works better for me too. Each of you are individual. Work with your doctor on optimizing your hormone regimen. And no hormone regimen is complete without hormone detox and supporting your body's natural anti-inflammatory processes. It's really key because it takes more than hormones to fix your hormones. You will hear me say that again and again and again, but it does. It takes more than hormones to fix your hormones. So optimizing your health and physiology makes a big difference. I really want to thank you for joining me on today's episode of the Girlfriend Doctor Show. I hope you feel empowered and inspired to take control of your hormone health. If you decide to use balance cream, let me know how you do with it. There's so much benefits for naturally derived progesterone and pregnenolone, and you deserve to feel vibrant and balanced at every stage of your life. Until next time, take care and stay balanced. This is Dr. Anna Cabeca. God bless you.